Hi, I'm Carol Joy Bender, the nurse practitioner and the founder of Joy Wellness Partners. As you prepare for your stellate ganglion block experience, I wanted to give you all the tips that we've learned over the years that have helped our patients to have amazing experiences here. Many people in life get on sympathetic overdrive. They have a heightened response to stress, and that stress can propagate. And that's really where PTSD comes from. PTSD can turn into depression in 80% of the cases. A lot of our patients have had one-time trauma that has changed their response to stress in life forever. Other patients have had chronic PTSD or chronic complex PTSD, where it's been continuous episodes of stressful triggers, traumatic events that have caused them to be in fight or flight mode for the majority of their life. There's a lot of things we can see in patients that have had an overdrive of their fight or flight nervous system. So we look at the large size of their pupils, that their heart is racing, that they have a higher blood pressure, that they have a difficulty with digestion in many cases. Not everybody has all these responses all the time, but over time, the increased fight or flight response doesn't serve us well anymore in our current day and age. When we have road rage or when we have somebody cut us off in traffic, that shouldn't trigger the physiologic body response of running from a tiger in the jungle. If we have conflict in our home or with our kids or our spouse or our partners, we shouldn't be triggered to run away or fight immediately. There is usually a gradient of responsiveness from 0 to 10 that we want to stay most of the time when we are facing an experience in the 0 to 1, because most things in our American life or in our life around the world, when we're going through our day to day, we're trying to have good relationships, to be at peace, to appreciate the sunrise and the sunset, to have our meals, and we're trying to digest our food and sleep every night. Well, if we're in the sympathetic nervous system overdrive mode most of the time, then we're going to be suppressing that relax, that digest, that be at peace, that be creative, that be efficient and get things done mode that is only possible when we're not running from that imminent threat of danger to our lives. So the stellate ganglion block is a way to restore the balance, to give us back our ability to look at the sunset and appreciate it, to have a romantic relationship, including all of the sexual experiences that we ought to have too in our relationships. The ability of the stellate ganglion block reset is to turn off that sympathetic nervous system for a period of 6 hours. And we also use the stellate ganglion block procedure to often block the vagus nerve at the same time and allow that to come reset after 6 hours, so that there's a balance again of our body being able to live at baseline more in the rest and digest mode. And then when it needs to, flip into fight or flight only for important moments. A lot of patients will ask us if they lose their edge from the stellate ganglion procedure. And we tell them no, in any way, they actually get improvement in their ability to react to situations when they need to, like improvement that we'll talk about later. What to expect at the treatment. So you can prepare for the procedure by reading your consents, which includes some what to expect paperwork, a lot of things I'll go through in this video. We want you to be able to be comfortable and wear your own comfortable clothes for the procedure. There's an IV placed in your arm for safety. We'll be checking your vital signs at the beginning and making sure you're a candidate that day medically, as well as monitoring your vital signs throughout the procedure. We give you the options of choosing your own music if you let us know what you are relaxed by, and we give you blankets or control the temperature in the room so that you can have a comfortable setting. We'll talk to you at the procedure time about the left or the right side of the block, and we'll be performing an ultrasound, which is like a plastic looking probe that rubs on your neck for a few minutes to look at the anatomy and make sure that we find the right location for your block. And that's what we also use to guide the injection into the area where we're going to be injecting. We use the stellate, the injection around the stellate nerve and around the vagus nerve, not going into any nerves, not going into any blood vessels, because we have the ultrasound to guide us perfectly to the right spot. We go in between the layers of two different muscles that help us to know we are where we're supposed to be. And we can watch the fluid. We always aspirate, so we have 100% safety with all of our procedures. The needle's out within 30 seconds after it's in, so within the time that you can count down, usually you're able to make it through knowing the benefits you're going to receive. After the procedure, we have you lay flat for 10 minutes on that bed of your treatment, and then we'll be able to move you to your recovery room after approximately those 10 minutes or longer, depending on your condition. We want you to prepare for the possibility of not being able to swallow food for up to 6 hours after the procedure. So we might recommend an IV infusion if you want to up your hydration while you might be not able to swallow too much for a few hours. The anesthetic always wears off. It's never permanent. Plan to have a driver. It's best that you can have someone drive you home so you don't have that unnecessary stress of being the driver and having to pay attention that day of the procedure. If a driver is not possible, then we would ask you to stay for at least 6 hours after your procedure. So to prepare for the best experience, there's some tips. Like we mentioned, read what to expect, stop any blood thinning medications. That can even include aspirin and Aleve for up to 3 days before the treatment. That's to have the least amount of bruising and bleeding chance. We want you to eat a meal and drink plenty of fluids before the block that very morning that you come in. So a couple hours before or an hour before you can eat. Schedule your driver and allow for 2 to 4 hours at the clinic and up to 6 if you are driving yourself. To have the best experience, we want you to reduce the stimuli, the things that are going to press the gas pedal down to the brain, the stimulants to the brain like caffeine and nicotine. And we want you to let us know if you have any specific triggers of trauma from medical procedures or needles, because we can help you with that with laughing gas type treatments or other medication to calm your nerves before the treatment. Wear comfortable clothes that we can access your neck, get to the neck with the ultrasound probe. But it's your clothing that you get to wear. You don't have to change into a gown. Plan for a calming day afterwards. It might require you to plan for some childcare afterwards so that you can really relax. A lot of people feel like they don't want to do anything at all. They just want to lay on the couch, snooze, take a 15-hour nighttime sleep, and that's okay. That's probably what you need. So allow yourself to reduce any screen time and just get that rest that you deserve. So after the block, after that 30-second injection, you're going to be laying flat on the table for 10 minutes, and we expect to see developing over that first few 3 to 5 minutes a red droopy eye. We expect you to see we want to see a pupil constriction on the side that we did the injection. So if you had the stellate ganglion block on the right side, we want to see your right eye get droopy. We want to see the pupil constrict on the right side, and we'll often notice that you have warmth on your neck and your cheek on the right side. We want you to have a difference in the pulses that we feel on both sides, where one will be much more dramatic than the other as a result of the block. We sometimes start to feel a little tickle in the throat, but oftentimes that takes a little bit longer to set in. People may feel an immediate increased ability to take a deep breath, or like a backpack has been lifted off their shoulders. They may feel giddy, like they can laugh freely, really happy, really light. Those are awesome initial expected responses. An hour after the procedure, we move you to the recovery room, and we expect you to have possibility of a swollen feeling throat because of where the anesthetic is placed around your stellate and your vagus nerve. There's another nerve around there that can make your throat feel puffy or like it's difficult to swallow. You might want to spit your phlegm out into the bag that we give you instead of coughing or choking on it. If you know it's coming, it's usually much less severe than expected. Some feel a huge ease in breathing, and occasionally patients have told us that it feels a little more difficult to breathe, but we have your vital signs monitored. If you have any challenges, please let us know, and we'll be more than happy to bring you anything you need to make it more comfortable. Oxygen, We talked about the IV with magnesium, and a lot of vitamins can help you to relax as you're resting and recovering, as well as give you the hydration so you don't have to worry about, getting dehydrated after you're done with the injection. You may have a runny nose or feel a little sleepy. Hopefully, you feel a real relaxed feeling. And it's okay if you feel a little wobbly or unsteady when you stand up and take a few steps down the hall, like you're going to fall into the wall on the right side. That's okay. That's normal. That's expected after the block because your blood pressure gets equilibrated differently for that period of time when your block is in effect. It all wears off. It always wears off around 6 hours for most people. It's possible that you feel very little change after this first block in the initial hours. Try to allow for that possibility and keep observing your response over the next few weeks and months. A couple hours after the procedure, when you're driving home, up to 6 hours after, you could have a little difficulty swallowing. So you'll want to take food and water very cautiously and avoid it completely if you feel any of those symptoms. Sleep, relax as much as possible, practice some healthy techniques. We have some tips we can give you: mindfulness, gratitude, prayer. We have a gratitude journal that a lot of patients like to obtain at the clinic. It's also helpful to practice these things before the block too, if you have the ability to get started in that. And continue seeing your mental health provider if you have one, so that you can continue to get the benefits, and they may even be more beneficial afterwards. Now, if you have that initial change, very little initial change, like I said, just keep observing and keep noting of that. And we'll send you an email a couple weeks after the block, and you can write back to us if you have any questions. Some patients will find that they have a better response from one side or another. And a lot of patients will talk about doing both sides within a short period of time. If you're traveling from out of town, that's probably a good idea, so that you're able to do 2 stellate ganglion blocks within 2 or 3 days of each other and have the travel be condensed. But if you're local, there's really no rush. Sometimes it takes a week or two, or even a month or two, to get the full effects from your first block. There's about 80 to 90% of people who have an improvement on the right side from the research that was performed by Sean Mulvaney on several thousand military veterans, active duty and military and veterans. So we've recently been seeing that there's a lot of patients that get to a higher percentage, and Dr. Mulvaney's research showed that 80 to 85% goes up to 90 to 95% once patients have the block done on the left side. So if you have no response or very little response on the right side, you could be one of that 10% that needs the left side done. But the benefits you can see: you should notice an improvement in your sleep, ability to deep dream, reduction in hyperreactivity, reduction in road rage is one of the first things a lot of patients will tell us. Improvement in your focus, mental clarity, reduction in that background noise, that there's not those 10 conversations going on all the time in the back of your head when you're just trying to be in present moment with your loved one and talk to them and listen to them. Many people, including myself, noticed an improved ability to listen and hear what people were saying to me after the block. So a lot of times the people will say that they got their spouse back, they have their marriage back, they finally have the person that they originally met back in their life with them, which gives people, of course, hope, creativity, gratitude. Many people notice an improvement in their reduction in their pain level. Some of that even happens as they're at the clinic within the first 6 hours after the procedure, as the video that was playing to their brain that wasn't real about pain, like phantom limb pain, for example, can be reduced with the stellate ganglion block immediately. Counseling sessions, like I talked about, can get more effective and efficient. People notice that, contrary to their initial fears, where they're thinking, oh, I might lose my edge, we found that their sprint times, their long distance mileage ability, and their cardiovascular stamina and heart rate variability improves and gets better. They have better shooting accuracy, higher jump heights that they can jump, a lot of athletic improvements, physical improvements, even like digestion that we talked about. To maximize the benefits of the stellate block, there are helpful things that you can do, and really a lot of it is the more challenging side of things, but the stellate block opens the door for you to be able to do these things again. So if you need more tips, we really recommend scheduling a consultation with our naturopathic doctor so that we can go through even more specific personalized medicine and opportunity for you to get well in all areas of your life, hormone balancing, uh, decreasing toxins, toxic burden like metal detoxing, other things that may be related to your, PTSD or layered underneath that PTSD. So we have opportunity for the repeat on the other side if you need to. And we would recommend ketamine for anyone who still has that depression lingering or that didn't have that full response, like that 5% of people that don't respond to both sides stellates often respond pretty much almost 100% of the time with the ketamine. So Joy Wellness Partners is your place that you're coming for your block, and we want to reassure you that you are here in a safe place where ultrasound expertise has guided over 800 injections with many different approaches of wellness through our integrative team of naturopathic doctors, medical doctors, and nurse practitioners. We follow the protocol of Dr. Sean Mulvaney for the Stellate block, and we know what PTSD is like from the family and the friends in our community. As a military spouse, I have a lot of compassion and a lot of passion for the opportunity to help our San Diego community and the whole country. There's probably as many non-military personnel coming to our clinic as there are military, retired active duty. So we're very, very aware that stress can influence different individuals at different levels, but getting yourself back into balance is key for feeling optimally well. And I can speak to personal experience that the Stellate block really, really helped me in many aspects of my life. But to be able to live in the present moment and enjoy the present moment is priceless. The discounts we offer for local deals if you live locally, and then the hotel vouchers for travelers are ways that we try to make it more accessible for you. And there's also some nonprofit organizations that you can look at our charities page on our website to see if you're a candidate for a discounted or cost-free stellate ganglion block through our clinic. And we just try to strive for the most caring customer service that provides patients with the answers to their questions and before they even ask. If you have any more questions that we didn't answer, please call us or text us or email us. And we look forward to seeing you very soon.